6, 7. Release.
All right, so Daryl, you're going to do your procedure with Dr. Davis now. Before we get started, we're going to we're going to have you do a couple movements to see where you're starting.
Okay.
And then we'll have you do the same ones to see where you're ending.
Okay.
But why did you give us a call? Why did you want to see Dr. Davis?
Actually, I saw a video on TV one morning. I was laying in bed, kind of laying on my infrared bed, eating pad because of my back. And I said, I'm going to call him because I liked what I saw.
Good. And you have problem with, as we can see, there's, yep, your knees.
Both
And,
of them, yeah.
yes. Did you go to any other doctors?
No, I had the injections, the chicken, whatever, the Rooster things or whatever, they're in my knee. Didn't do anything except for maybe 1 week. And then after I had all 3 shots, I couldn't tell any difference.
Oh,
It's like
yeah.
a waste of whatever.
Yeah, a lot of times that happens with people. So let's get started. Let's have you do a couple movements. I'll have you stand up first.
Okay.
And tell me, did that cause any discomfort?
No, because I used my right leg.
So you didn't use the left side because of it. Oh.
I favor this so much. It's like I told Dr. Davis, my leg has got so small compared to this thigh.
Oh,
I was
yeah.
a punter in college, and I used my left leg for pushing lots of weight. I don't use it at all anymore.
All right.
So the difference in thickness from here to here is amazing.
I see that. I see that.
It's
So
that
we're
noticeable.
gonna try a squat then, and you are gonna
It's going to be a hard time with the left leg.
We're gonna do what you can,
Okay.
and then you'll come right back up. So step forward.
Okay.
Have your feet shoulder width apart. Hands forward. Try to squat.
Okay, see the right leg's taking over right now.
Yeah, I saw that. You're favoring.
I'm
Okay.
leaning to the right.
Yeah,
right now.
let's
I
go.
can't- I
Try to
can't
put
go-
a little bit on there and see
Yeah,
what happens.
That's bad. It's starting to
All
get
right,
sharp.
let's go up then. What's that pain level on that left side then?
Because it was actually going up into my hip. It was probably, I don't know, 6, maybe 5, 6.
5 or
It was
6?
something uncomfortable. If I'd have stayed there, it would have got worse.
Yeah.
It's getting worse than the knee right now.
Yeah, let's not do it anymore for
Okay.
now. And let's try the stairs. Let's try tandem. But you can hold on.
Okay.
Yeah.
You want me to do both of them at the same time? Or just want to walk down separate?
Like walk down the stairs.
That's pretty easy for me.
All right. What about going up the stairs?
Yeah, not so much of a problem. Unless I would have a lot. Yeah, see, the left side is the problem.
It'll
I
do
favor the
that.
left leg, yeah.
All right, that's good. You know what? Do me a favor. Point to where it hurts on that knee when you start feeling the pain.
Right in here.
All right. And then you said you did feel it all the way up
Yeah,
to...
actually, being I haven't done that particular movement in a long time. I mean, when I squat, it went into this part of my hip, like
Well, we'll get started and...
lumbar almost.
All right, we'll get started and see what we can do.
Deep breath in and press. 1, that's it right there. 2, 3, 4, 5, 6, 7. Release.
Good.
Deep breath in and press into my hand. 1, 2, 3, 4, 5, 6, 7. Release.
What?
Disco kid.
Tell me if you feel any differences.
Yeah, I don't feel any tightness really in my left leg.
Good, good.
Squat down.
Yeah, I don't feel like, it doesn't feel as tight. When I walked in here, it just felt like somebody was putting their weight on it.
Oh, well, let's go outside and see
Yeah,
what
feels
else we... You just went from standing to sitting, and you told me just now what?
It feels as good as my right leg, which
That's
doesn't really
so
hurt.
great.
So it really feels good. It really does.
So what we're talking about with Daryl is that, Daryl, you just did your procedure with Dr. Davis.
Yeah.
So we're going to do those movements again and see where you're at. So I'm going to have you stand up. And how did that feel?
It felt really good because I didn't feel any discomfort in my left side at all.
All right,
That was
we're
really
gonna
good.
we're gonna try to put some weight on it this time. So let's try a squat. Step forward,
Okay.
shoulder width apart, hands forward, and let's see what you could do.
Just a little twinge, not much.
You're not leaning to the right.
No.
Why
No.
not?
Because it feels like I can use it. Like I said, that's why I think I just got a little bit of pressure because before I didn't use the left leg at all.
Yep.
It was like all here.
Yep.
That's
And
why
we've
this
got-
size so much bigger than that one.
Let me see you do that on the other side.
Yeah. See, it's taking most of the pressure right now. I got nothing here. I couldn't have done that.
You
earlier.
couldn't have done it before.
And there's just a little
Awesome.
bit of discomfort right here. That's all.
Let's see if you feel any different going down the stairs, because I know you didn't quite have discomfort, but maybe it's different now.
No, it feels really good. It does. It feels good. It feels a little bit better.
Oh, good.
I don't see the discomfort here as much as I do like squat.
That squat made a big difference
Yeah.
because you were lifting really heavy things.
I do lift really. I mean, for being 69, I still lift. Some of our bags of concrete mix are 100 pounds. Most of them are 90.
You don't look
So I-
69.
Yes, yeah, so I do. And I carry it, and I carry a lot of that stuff
Yeah.
because I hate for a younger guy to outdo me. I mean,
Yeah, I hear you.
Just my whole life. I've been
Let's
like
go
that.
up. Let's see what's going on here.
Yeah, it's good.
Yeah.
Yeah, very good.
So you went when you did a squat. You were up to about a 6, 5, 6 with that pain
It was
level.
pretty bad. It was.
And where-
I mean, when I came out here the first time,
Mhm.
it was almost all. I do that intentionally. That's why this leg's so much bigger now.
Yes.
This leg was twice as big as this because like I told you.
We're gonna make it bigger.
Yeah, now it's disappearing. It's so much smaller than this.
But
You
we're
can
gonna
see
make
the
it
knee.
bigger.
Oh, that'd be great.
We're gonna get it stronger. So where would you say you were at with that squat for your number?
The last one I just did.
Yep.
It was like I said, 2 or 1, maybe a 1 because I barely felt it.
Oh, that's amazing. And that's
Yeah.
without
That
the
was
rest
good.
of what we
That
can
was
do.
good.
Awesome.